the content because you haven't had it all just yet, right? So do your best with it. Then you've got remediation due, I believe, on the 26th. And then what we are doing, or what we kind of decided that we were going to do, is before the final, we'll meet together as a group. So while you're in practicum, if you're available, and we'll go through practice assessment B together, or some of it anyway. That way we can review some of the content that's important, and just talking through questions I think is helpful, because your thought process may have been a little bit different, and other students saying, well, this is how I'm approaching it, I think will be helpful before you come back week 11 to take your final and your ATI. So that's kind of what we have planned. Next week we have class on Wednesday, and then Friday is your second exam at 1:30 with class to follow. I'll try to make it as concise as possible. I know that's going to be another long day, and then that's the last class that we meet. So it's moving very, very quickly. And then you will be in practicum. Somebody had a question. Okay, thank you. All right. So my slides are showing. Or are my slides showing?
Yes.
Thank you. All right. So chapter 12 talks about organizational structure. And within an organization, for any of you who have had a job in any field, there is that formal structure, and that is where they've assigned people as different positions, managerial positions. Everybody has their job description, their responsibility, the tasks that they're accountable for. So that's your formal layout. But think about a job that you may have had, or you've been a part of an organization where there was actually an informal structure. So there were employees that developed relationships, and within that portion of the organizational structure, there were leaders, even though they weren't titled as a leader or a manager. Can anyone give, like from a previous life, an example of where it maybe wasn't your manager, but there was an individual or individuals that were kind of the go-to people because informally they took on a leadership role? Has anyone experienced that before?
I think I see that in general when people are a hard worker, if they've been there for a long time and they don't want to go to management, but they're part of like that team crew. So you have like a relationship with them, but they kind of tend to be a little bit overworked, kind of. Is that what you mean?
They can be, for sure. It's an individual who the rest of the team sees as a leader. They don't have the title. So maybe, let's say in a nursing world, it could still be a staff member. So it's not a charge nurse, it's not a nurse manager, but it's somebody, and a lot of times it is somebody who's been there a while. They have a lot of experience, and they are seen by the rest of the team as a leader. So when somebody has a problem, they may go to that individual. So that's an informal organizational structure versus having this person is your manager, here's your charge manager. And that really evolves in all organizations, doesn't matter the field, because people by nature either tend to be leaders or followers. You're a little bit of both, but some people just are natural leaders. And so when they've been in a position for a while, they have a lot of expertise, a lot of knowledge. Other people gravitate towards them because they feel like that's somebody who knows what they're doing. They can answer my questions. So that's an informal structure. You know, there's no exact titles given to those people, but it certainly exists. Anyone else experience that where it wasn't somebody with a formal title, but they were a part of the leadership?
Yeah, last week they told me that I would be the leader of the presentation for what we were presenting.
Okay. Oh, right. So there you go. Yeah. And so, and a lot of times, even when you're, okay, think about that when you've been doing teamwork even in school, is there somebody that you guys always point to and say, you are gonna speak for the class? Or, you know, those are people who tend to have leadership qualities, and they're not maybe the class president or what, you know, nothing formal, but the rest of the classmates see them for their leadership. And it's a whole relationship dynamic that's evolved where there's no set structure for it. It just happens. And so that's a good example, Uma, because maybe your classmates see you in that leadership role, even though, you know, you don't have a formal title for it. So those informal groups are still going to have leadership, and they have their own communication. And typically that type of communication, you've probably heard of it, is through the grapevine, right? So you're not going to get formal memos on information, but pieces of information are still going to be transferred amongst the group, but it's done just more of an informal. But those relationships are still very important. And so if you do work, kind of think about, you don't have to talk about it, but just think, like, how does that exist on my unit? Or if you're at clinicals, like, is there somebody who's the go-to or the one that everybody sees as a leader, even though they're not a manager? When we talk about span of control, that's the amount of people that report to one individual manager, and then the amount of people that manager is expected to interact with really on a day-to-day basis. If you have too many people reporting to one person, it does become overwhelming, and it can really delay the manager's ability to make decisions and get all of the work done because they have so many reports. On the flip side, if you have too few people reporting to a manager, it becomes really top heavy as far as leadership. It kind of goes along with that saying, like, too many chiefs and not enough Indians. You have too many people in charge and not enough people actually carrying out the work. And that can happen as well. It's a very expensive way to do it, but typically you're going to see it the other way, where one person is in charge of all these individuals, and it may not be the most efficient manner. There really has to be a good balance so it doesn't become top heavy, but that we're still waiting on decisions to be made because that one person is being overwhelmed. Unity of command. So this is one person, one boss, and the employees have a manager to whom they report to. So think of unity of command very similar to like the chain of command. So who can share with me what your chain of command would be here at ECPI as a student? What's your chain of command, let's say for this course?
Professor first.
Correct. And what if you don't get a resolution with me? Who do you go to?
The dean.
Dr. Trainer.
The program director. Yep. So Dr. Trainer, the program director. Okay. So you went there, didn't get a resolution. Then who do you go to?
President Fontaine.
The dean. So it's professor, program director, the dean, Mr. Fontaine. Now let's say you've gone through Mr. Fontaine. Let's say you're filing a grievance of some sort. You've gone through Mr. Fontaine and you still don't get a resolution to the problem. Does anyone know what that next step would be?
Corporate office.
Correct. So you see how you always want to start at your first person that you report to. Now imagine if you work in a unit, chances are as a staff nurse, you're going to report to a charge nurse. So if you start having an issue with a patient and you don't follow the chain of command and you just march right into the CEO of the hospital's office, there's a whole list of individuals that you bypassed in order to air your grievance or your problem or to try to find resolution. In a professional workplace, you always want to follow the chain of command, although there are going to be certain circumstances where you may have to bypass it. So for instance, in this class, if something happened and I was the one who did it. So maybe I don't know, I'm cursing on lecture and I went on a rampage and I was being very, disrespectful. Coming to me, you can have a conversation with that individual, but in that circumstance, it would be acceptable to bypass that individual and go to the person above them, or you've had multiple problems with me. And so coming to me, you've already come to me, it's not going to solve the problem because it continues to happen, then it's acceptable to bypass it. Something to keep in mind at your workplace, because it is very frowned upon to bypass your chain of command. So you always want to, unless it's a specific function where you are reporting for the completion of that task to somebody else, follow your chain of command. And so most workplaces are going to have an organizational chart where it's mapped out. They use like solid lines and then dotted lines. You'll see who is at the very top, the CEO. You'll see the people who report to the CEO, and then all of the people that report to those two individuals. And it keeps branching down. And then as a staff nurse, those other staff nurses are all at a lateral position to what your position is. You're not a director, you're not a manager, you're a staff nurse. So you're kind of in alignment with all of the other staff nurses. So you look at what is listed above you as to who your direct report is. And so typically that's going to be somebody like a charge nurse. Then it may go to a nurse manager or a director of nursing, and you keep moving up in that manner. So a lot of times on hire, you may get a picture of the organizational chart. I will tell you, a lot of times those are not updated. Just with organizations, they get outdated, people change positions. And so unfortunately, occasionally they're inaccurate. But for the most part, you should have a clear knowledge of who reports to who, so that if anything is to come, you know exactly who to go to and you can follow your chain of command. So when we talk about centrality, it's a network of the relationships that exist between people in a healthcare system or in the work system. Typically the middle manager, so not upper management, not the CEO, but we're talking more middle management. So maybe like a director of nursing. They are an individual who's considered to have centrality because they have a bit of a broader view of what is going on in the organization, and they communicate with multiple members of the team. So think who kind of lies in that middle area, and I'll show you a picture of what is considered like frontline versus lower management, middle management, and upper management. So your top level managers, these are at the top of the scheme, the pyramid, the organizational chart. That's going to be your CEO. That's your board of directors. So CEO is a chief executive officer. A lot of times healthcare organizations have a CNO, which is a chief nursing officer, or it's administrators. So those are people at the very top level of management. Are these individuals typically doing the patient care, and are you seeing them on a day-to-day basis?
No.
Most of the time you're not. If you work in a small area, like I worked in a surgery center, I did see my administrator because they were based out of the surgery center, so I was able to see them. But in a hospital on a daily basis, you're probably not going to see the CEO. You may not see the CNO. You may get webinars where they give you information, but it's not your daily communication. Your mid-level managers, this is your nursing supervisors and directors, the department heads. These are people right along that middle management who are having centrality because they have communication with so many individuals below and above. Your first level managers are the ones that are typically going to be your direct report as a staff nurse. It's a team leader, it can be called a charge nurse, primary care nurses, case managers. These are that first level management, and then we keep moving up the pyramid. So in centralized decision making, decisions are made at the top. And we just talked about the fact that you're not seeing them probably on a day-to-day basis. And a lot of times they may not even be at your facility. So has anyone ever worked in a place, and we're going to watch a short video to understand centralized versus decentralized, but has anyone worked somewhere where the decisions were made at that top level, but they kind of really didn't know what you were doing on a day-to-day basis, but they're making the decisions for you? Has anyone had that happen to them?
Yes.
Can you give just, you don't have to give names of anything, but can you give just an overview of either what happened or the possible frustration that came from it, or did it work really well?
Sure. So I'll give you an example. When I worked for a dental company,
Okay.
so you will have like somebody who's sitting in a corporate office and says, okay, we need to shorten the time that our dental assistants are spending when they're admitting the patients, when they do the x-rays and so forth and so on. But then yet you're jamming about 10 patients per day and you only have 5 chairs to accept them. So that kind of creates, like, you have a production, you have, new patients and whatnot. So that person who's actually going to do the admission of the patient is a DA. So let's say that their education is not quite where it has to be. Their emotional maturity is not quite where it has to be. All they know, they need to hurry up and get that patient into the chair, take their x-rays within a certain time frame, and get the correct x-rays, because x-rays could be finicky, right? Mm-hmm. So when they're making that decision, all they're looking at the time slot and how many patients they could fit into the day, whereas they're not considering the skill set of the dental assistant, or maybe the doctor is needing more of that x-ray and there's only 1 x-ray per office.
Yeah, absolutely. And were they on site with you at the dental office, or was that being made by somebody else?
It was made by somebody else in the central corporate office.
Right. So that is a good example. And I dealt with something similar, and it usually is regarding timing, staffing, labor hours. So I remember that I would be on a meeting with a new, I don't remember if they were like a finance grad, but it was somebody working with spreadsheets and numbers and financials. They were dictating how many nurses we need on a daily basis. So you had labor hours that you had to look at in staffing, right? Which we talked about. That's a role of the nurse leader and the nurse manager, is to staff, really the manager, is to staff appropriately. You can't have so many nurses that people are walking around with nothing to do, but you can't have so few that it becomes a patient care issue. So I remember being on like a webinar because they were out of a different state. Really not a lot of healthcare experience whatsoever. They were educated in financial information. So a lot of things look great on paper. They do. All the numbers add up, they equal 100%. And so this is what we need to do. But when you're down multiple levels and you're doing the work and you know the different things that come into it, skill set, physician slowdown, x-ray machine issues, whatever it might be, that isn't really practical. Even though all the numbers add up, it's just not feasible. So sometimes, and there's pros and cons to both of these, but sometimes it is a little, when somebody's so far removed from the front line, which front line is like the people taking care of the patients, when they're so far removed and they're making decisions, there is an opportunity for key elements of the issue to not be known, or to not even be thought of, because they don't see the practicality in it. They're looking at one specific thing, which is time. They want the timing spent with the patient to be reduced. So always pros and cons. So that's a centralized decision making. So think it's top down. It's top of the hierarchy making decisions, and it goes centralized down. So that's it. Just that all the decisions are going to get handed out. It would be similar with ECPI. Like ECPI's corporate is in Virginia. We're in Orlando. So if all of the decisions for our university came strictly from the CEO, they may be missing some of the pieces as to what's happening on the Orlando campus and how our program runs and the things we deal with in Central Florida. So hopefully that kind of helps you to understand. When there's decentralized decision making, they allow the decision making to be diffused through the organization. And so it kind of empowers those lower level managers to make some decisions. I see a benefit in decentralized decision making because now if you're having an issue on your unit and you're a staff nurse and you go to your charge nurse, they're probably going to be extremely knowledgeable of the workings of your unit, the problems that you face, the supplies that you have, you know, whatever. They have that working knowledge of being there, seeing, understanding all of the components, and it gives them the autonomy to make a decision to solve those problems, as opposed to saying, okay, I understand that we're short-staffed today. Let me call the CEO and see what they want me to do about it because I don't have the authority to make that decision. So let's watch a video real quick on centralized versus decentralized. This is not necessarily a nursing, sorry, I'm gonna get my toolbar. This is not necessarily a nursing video. What is happening here? Hang on. Is my YouTube visible? Sorry, I had to get here a different way. I just want to make sure I didn't disconnect.
Yes.
Okay, so this is just a gentleman talking about in any organization what the differences are between centralization and decentralization. And he discusses pros and cons to both because they're not, one isn't bad, one isn't good.
In this video, we're going to talk about the difference between centralization and decentralization in organizations. So let's unpack the details. Hello again, friends. Alex Lyon here. If you've never tuned into this channel before, Communication Coach, we put out weekly videos on professional communication and leadership skills. And today we're going to talk about centralization versus decentralization in organizational settings. I think once you see each of these in their side-by-side comparisons, you'll be able to see your own personal experience a little bit more clearly and understand how organizations work. And as we talk about each of these, I would like to invite you to make a comment below in that section below the video about where you see the strengths and the disadvantages under each of these models. So let's start with the centralized style of organizational structure. This is where you see all of the power concentrated in a single individual or a small group of individuals. In fact, the telltale sign you're dealing with a centralized type of organization is where the top boss is the president, CEO, and chairman of the board. That's highly centralized authority under one person. And as a result, all of the power, authority, and the decision-making power is held in that person's hands. So a lot of times what you'll see is quite a bit of top-down communication where the person in the top position makes a decision and hands that communication down, hands that decision down, and the communication flows down the chain of command all the way eventually down to the people at the front line of the organization. So in that way, you have what we call the classic hierarchy. You have all of the levels represented like in a military style where you have the top general, so to speak, the top officers, and then all the middle people, and then finally the frontline supervisors and frontline employees. So it's a pyramid, if you will. And as part of every pyramid, you also frequently see division of labor, where each of these jobs is broken up into small little pieces. So you might do one little thing and then hand it off to the next person. It's a little bit like an assembly line where everybody just does one little tiny piece of the job to complete the job overall in the end. Now, even if you're in an office setting, by the way, you can still feel this assembly line philosophy woven into this hierarchy and this division of labor style that you often see in a centralized style of organization. So what we end up with is something that is tightly coupled, a system that has tight coupling. So everything in the organization is directly connected. And if one thing happens in this department, the other departments feel the jolt. So anytime something happens in an assembly line, let's say you're going from A to Z to finish your product, if something happens at step C, the whole assembly line has to stop, and that becomes a really big problem for the organization because all the work grinds to a complete halt. So it's tightly coupled. Now, the upside of a centralized style of organization is control and stability. In fact, the whole thing is designed for control. So if you consider that an advantage, then it is. The downside is that they're not very flexible. So if change happens, they're pretty bad at adapting to that change, especially in the marketplace. And also, they're really bad at upward communication, that bottom up communication. So if there's good feedback from employees or from customers, it doesn't really make it to the top level decision makers through all those levels of hierarchy. And if they do hear about something, it's usually distorted or tainted a little bit. So that's the centralized style. Now let's contrast that with the decentralized style of organizations. And this is where the control is spread out. So you don't have one person that's the chairman, the CEO, and the president. You have people in different positions like this so that decision-making power is somewhat spread out. Authority is somewhat spread out. Just like in the states of the United States, we have 50 states. We have a central government. Let's just pretend for a minute that our country was more emphasized on the state level control. That would be a little bit more decentralized. And it's the same way in an organization. When power is distributed between and among the teams or the units or the department heads, that's a little bit more decentralized. So it doesn't all have to go through the people at the very, very top of the hierarchy. And so as a result, you often have decision-making power as well as communication spread out throughout the groups and the team. So lots more communication between and among team members on a team and between and among the teams themselves. So not a hierarchy and division of labor, but this team-based work. So you have a lot of cross-training. People know how to do multiple jobs and know how to learn over time through cross-training how to work with others outside of their immediate department. You end up with something called a loosely coupled system. So instead of an assembly line where it's tightly coupled and everything is directly affecting the other, a loosely coupled system is where the pieces are still connected, but the connection is more of an interdependent connection. So if one team has a problem, it's not likely to directly affect the other teams. They might feel some influence eventually, but the other teams can keep working. The assembly line doesn't grind to a halt because it's not organized that way. So the advantages of a decentralized organization, obviously it's flexible and adaptable to changes in the marketplace, and usually teams produce very high quality products and services. The downside is that coordination is not automatic, and teams have to learn over time to get better at communicating between and among the teams so that they're not just working in a completely isolated fashion. They have to work all together as well at times. So there's a contrasting look and a comparison at centralized versus decentralized organizations.
So based off of that, can you see which one is more likely to be seen like in a hospital organization? Which one do you think?
Centralized.
So you think it's centralized that you're going to see more often?
I think decentralized.
Okay, so why the centralized, and then I'm going to come back to you for the decentralized. Why do you feel it is more centralized decision making?
I was thinking because like Orlando Health, I guess, just to say that just all the policies are for everyone. So that was established by, I'm just thinking that they don't really give flexibility to like the lower ones due to like all the math and the finances and everything. This is how we have to do it.
Okay. Okay. And then why did you feel the decentralized? I think it was Kendrick. I can't see.
Yeah. I think it's decentralized because like from where I work, we don't hear much from upper management. I mean, we get the occasional email, hey, you guys are doing great, blah, blah, blah. But then most of the other decisions are made by our managers and assistant nurse managers. Like, for example, we had an email that came out the other day saying, you guys can't be telling people, oh, we can't see you this quickly because it's going to take a very long time. And they made a script for us that we have to say. And that's not from like the CEO or anything. That's from our direct managers.
Okay. So I think you're both correct in that it can be a little bit of both. What you might find at some organizations and hospitals that there are some policies that they are going to be the same for every single employee. So some of that may come from the top down. A lot of times, though, what you probably are going to see is the decentralized. So like in Kendrick's example, they were having potentially some team issues with verbiage or what they were saying to patients. So rather than calling the CEO and saying, how do we handle this? They made an adjustment that was best for their unit, their floor. And it was probably made by those first line managers, maybe even middle management. Maybe the lower level management may have consulted the middle management and just said, do you bounce some ideas off of them, but it's going to be directly related to his unit where it may not change the verbiage anywhere else. So I do think in an organization, you can kind of see a little bit of both. But now imagine if Kendrick's unit was having a problem. So maybe patients complained because some of the staff was telling patients they didn't have time to see them. And so to solve it, they called the CEO of the hospital and waited for a decision. So another downfall, rather than asking a question, of the centralized is that a lot of times you don't get decisions made quickly. If one person is making all of the decisions, all of the power lies in their hands, you may not get answers in a timely manner. And in healthcare and hospitals, a lot of times we need to be able to rectify a problem quickly. So you have to have the lower level management, middle management, who is empowered to be able to make those decisions. And quite honestly, they're the people who know the most about what's happening day to day in that unit or in that area, as opposed to somebody who gets reports and they get briefed on the information. And in the gentleman's example in the video, it would be the same as if we were having issues in Florida and just went straight to the president to try to find a response, when you have an individual in that area, in that state, who knows the state in and out versus all of the other states, and they can make a decision there. So there's going to be pros and cons to both. You may see a little bit of both, really depending on where you work. So looking at the line of either being centralized or decentralized, what would the literal shape of that line look like if an organization was more decentralized? If you were drawing it.
More horizontal?
Yeah, it's going to spread out more. It's going to be more flat as opposed to straight up and down. So just remember, just like you remembered the central nervous system, brain and spinal cord, center of the body, centralized organizations are going to be top down in a line. When it's decentralized, that line is going to flatten out so that at a lower level, decisions can be made. Organizational charts, this is what one may look like for your organization. And typically it's like in the employee handbook, you should get a diagram that maps out staff nurse is going to report to this person who then reports to this individual, and it keeps mapping out. So let's just say this person who's red, they're the CEO. And then there's 3 other top individuals that report to her, we'll call her or her. And then each of these 3 people have 2 people that report to them. So that really helps to identify the decision-making authority in the organization, which is helpful. It helps people understand what their role, their assignment is, how they fit into the organization. Where are they on this map? Where are they in the decision-making process? And then your line of communication. So there's probably going to be a circumstance at some point during your career where you have to start moving up that chain of command. Just remember, if at all possible, to follow the chain of command and not bypass it, although there are indications to skip somebody if that's the person you're having a problem with. Disadvantages of organizational charting is it doesn't show that informal organizational structure that we talked about, because remember, these are the actual assigned formal positions. It also does not show you the degree of authority by each person. So even though you see that Dr. Trainer is over the faculty who reports to the dean. It doesn't really tell you by looking at that chart exactly what Dr. Trainer's authority is. So that piece is often missing from the charting. And then you can also confuse authority with status. So, you know, pretty much everything we do has pros and cons, but I think for the chain of command, knowing the formal layout of an organization, it can be helpful, but it's helpful if it's updated correctly. They may have an upper level management who hasn't worked there in 5 years. So we're hoping that they look at that. Types of organizational structures, you can go through the different designs. I wanted to see organizational culture. So when we talk about an organization's culture, we're talking about their beliefs, their history, all of the formal, the informal relationships that exist within that organization and how that organization communicates. Much of a business's or an organization's culture is not readily available for you to retrieve. And it's something you glean from speaking with other coworkers. It's something you learn as you work there. It's not going to be something that says, this is our organizational culture where it's all mapped out. But you learn it as you work there, as you experience it, and as you learn it from, you know, individuals who have been there a while. Stakeholders in an organization are the ones that have an important component within that organization that usually is affected by the decisions that are made. So stakeholders in a company could be physicians, it could be community partners, it could be management, it could be the community. There's a financial component to it. So these are all people who play a role in the happenings of the organization, and they're affected by decisions that are made. Accountability, the definition of that's the moral responsibility that accompanies a position. So as a nurse, you have accountability that is obviously morally based. And then you have a responsibility, and the responsibility is that you have tasks that have to be completed due to what your job description says. So there's a difference between accountability versus your responsibility. That's going to be more task oriented. You're an RN, these are what you've been assigned, and then you having the authority to complete them. Authority is the power in order to act and direct the work of other people. So you have to have the authority along with a title. You can have a title, but if you really don't have the autonomy and the authority to make decisions and instruct the people below you, you can have a title that is shown on an organizational chart, but you may not have that authority, or you have limited authority. So maybe in the lower level management, they have authority to make decisions regarding staffing, but they may not have the authority to make any decision regarding something financial, like they can't potentially agree to trial out a new medical device. That may not fall within their authority. So not going to be evident on an organizational chart, but something you learn with each role. And then you've got the organizational culture again. This will talk about that a little bit more. And then the organizational climate. So that climate is often confused with culture, and your climate is how the coworkers, how the employees perceive that organization. So this can be very subjective. It could be accurate, could be inaccurate. It really depends on their experience with working there, happenings that, you know, have occurred, what types of experiences have they had. So the climate can vary, and it may not be a true accurate reflection because you've got the same people working in the same organization who view the organization differently. Example is you may speak to people who work at, let's say, Advent Health. They love it. They love X, Y, and Z about it. They can't imagine working anywhere else. And then you may talk to another individual that says, I feel that Advent Health doesn't care about employees. They don't treat us well, where the other person thought they got paid really well and the benefits were excellent. We don't know their history. We don't know where they came from. Maybe for them, it's wonderful, where the other person feels that they're not appreciated and that they don't make enough money and they're not compensated well enough. So that, just make sure you understand the difference in culture and climate. Shared governance. As a nurse, every nurse plays a role in decisions that affect nursing. You do, even though you may not be making decisions for an entire unit, you still have a role in that decision-making process. Nurse managers will start to become the spokesperson for how the processes are carried out in their unit. So then they have a little bit of a bigger voice, although all nurses should have a voice. And that's why it's called shared governance. So an example would be, we went over the chain of command at ECPI. When we make changes within the bachelor's to BSN program, input is elicited from students and it's elicited from faculty before a decision is made. So that there's a process involved with that. There's usually rules and bylaws that state that faculty will have a say if a textbook is going to be changed, things like that. Same thing would happen as it relates to like a hospital setting. So you still want the buy-in, the opinions in order to make a decision, where then you may have somebody at a managerial role that's kind of speaking on the behalf of the group. Participatory management, that lays the foundation for shared governance, but they're not the same. So in participatory management, it has the words participate in it, or the word participate. So it allows other people, other individuals, to also have a say and have some control over the decision making. So then by allowing other people to have that say, to have some control over decisions, it really identifies for the participant the real and final authority in that process. So shared participatory management is kind of a component of shared governance. And if you get the opinion of a group of individuals as opposed to two people making decisions for everything, that's what you're going to see most frequently, because now it's going to be more likely for you to get buy-in from the group because we elicited their response and they had some say in it. We've talked about empowering nurses and empowering people. If you've ever worked somewhere where you could make no decisions whatsoever, it's very disheartening. You feel like you have no control. You feel like potentially you're not trusted. You can't sometimes make a simple decision. And unfortunately, some of you will probably experience this in the workplace. But when you don't have that autonomy and that sense of autonomy as a nurse, it can start to affect your performance. And so nurses want to know that they have a voice and that they can make certain decisions on their own. They may need to consult the manager above them, but they can at least provide part of the piece of the puzzle so that the ultimate decision can be made for their benefit or for the benefit of the group as a whole. Magnet hospitals, I believe Orlando Health is still trying to obtain magnet status. I don't think, if somebody knows, correct me, I don't know that they've actually made it to magnet status yet. But there are certain components of a magnet hospital. The nurse executives in a decentralized environment, remember, not central, this is going to be more decentralized, and they are going to have participatory management. They are going to glean the advice and the perceptions from other nurses in making decisions. So they're inviting the other ancillary staff input. They want people participating in that decision. So maybe you'll see that sometimes at like a staff meeting. They will want, here's our problem. And rather than me saying, this is what we're going to do, what types of problem solving do you have? What are your suggestions as to how to solve this problem? And then you really get buy-in from everybody. Also at magnet hospitals, you're going to see more autonomy. You're going to see nurses who are able to fully practice with their clinical expertise. Staffing is more flexible. Staff ratios tend to be adequate and more appropriate. And then there's also career opportunities for nurses. So you'll see potentially like career ladders and ways for nurses to advance. And that's something that is very enticing to nurses to want to work for a facility that is a magnet hospital. They are in compliance with the ANA scope and standards for nurse administrators. They have a professional practice culture, and that exists through all levels of nursing care. So you're really going to see that top echelon in these facilities. The quality of the nursing leadership is going to be the best. Quality of care, quality improvement. Remember in research, we talked about evidence-based practice. Magnet facilities, that's their focus. You may end up working, I hope this doesn't happen, but you may end up working at one of those places where they don't change anything. They've been doing it like that for the last 18 years, and that's how they're going to keep doing it. Even though the evidence is so outdated and there are better ways of doing it, we can have better patient outcomes. Magnet hospitals are going to focus on evidence-based practice. They're going to have EBP committees. Nurses, as a nurse, you have an opportunity to sit on those committees. They talk about the recent literature, and they're open and adapting to change because they know that that is for the betterment for their patients, the organization, outcomes in general. So you can look at the rest of the different, you got autonomy, nurses as teachers in magnet facilities, a lot of professional development. They allow for that. They allow for, scholarly activities so that nurses can be abreast of the latest literature. So it's just, there's a lot of pros to working for a magnet facility, especially as it comes to patient care. Usually their quality care indicators are at the top. And they focus on that, and they readily make changes to get there. So as a new nurse, that's it's comforting because you know that you're doing things the right way and what best practice dictates versus we're doing it the way the manager who's been there for 25 years has done it for 22 years, and it can be a little bit outdated. You'll have opportunities to sit on committees. So committees, if an organization has too many committees, that actually is a sign that the organization is not properly structured. So you don't want a facility that has committees for everything. I think Nurse Blake does he does a couple of spoofs about committee leaders. There's a committee for this and a committee for that, and that's not a representative of them being more organized or more structured. So committees should have an appropriate number of members. You can't really have a committee with one person. So we have committees at ECPI. There's a admissions, progression, and graduation committee. You have to have substantial people there who are reviewing applicants. We have a educational resource and technology committee. So you have to have a representation from multiple units as well. And they're usually structured very well. We have an agenda. There's tasks that have to be completed. Somebody is usually designated as the leader of the committee to keep everybody on task. Otherwise, you got a bunch of people sitting around staring at each other and nobody really knows what we're supposed to be doing or what that next step is. So that is very structured, very organized, and it can be extremely effective. All right, so that's what I wanted to go over with you out of chapter 12. And then out of chapter 13, let me see here. This one goes over political, personal power, organizational power. So the beginning of the chapter will talk about different types of power. So this all you can read through. So when we do talk about power, how do you feel about power? Is power good or bad? So if an individual has a certain level of power, do you find that that's good or bad?
Depends on the individual.
Okay. And so can you elaborate on that?
Like, if they have a lot of power, but they're doing good for like their people, then isn't that a good thing?
Okay. So if you do have, so you're saying the person has to have enough power so that they're making decisions for whoever is underneath them, right?
Yep.
And that is a good thing. It goes back to what we talked about, that if they don't have power, they can have a title. They don't have power, they don't have the autonomy. Is that effective? Does anyone ever see that power could be bad?
Yes, but I don't want to say it.
Okay. Does anyone else ever think that power could be bad?
Yes, again, it depends on the individual who's holding the power or who's been given that power. You know, for example, I had a boss where I felt like I could teach my boss how to do certain things, and the boss didn't know how to. And I felt like, okay, well, why do I even have you? Because if I have something that I need to make a decision upon, you have absolutely no input because you have no knowledge and you have no respect from me.
Okay, yeah, that's a good example. I worked in a practice where it was a relative who was the office administrator. So they were the one kind of, it was very small organization, so only a couple people to report to. But she really held all of the power, not clinical, very little experience, not a nurse. And so sometimes having power and making decisions can be a little bit negative if that person isn't educated, they don't have the training, they don't have the knowledge, but yet they could potentially be making very, very important decisions. And I do think somebody could have too much power in their hands, and that can become a negative thing as well. So you've got to have enough power to properly run a unit, to be able to make those decisions without having too much. And so we talk about powerlessness. So the old adage that power corrupts might be true for some. And so that's kind of goes along that when somebody gets power, they may start abusing it, and they may start making changes and decisions that don't need to be made or aren't necessarily in the best interest. But we also have to look at people who are powerless. And that can be equally as corrupting to an organization, because you have somebody in a role, but they don't have the authority and the power to do anything. How can you get decisions? How can you get processes changed when they're just not bestowed with any power to handle those types of situations? So that can be equally as destructive to a hospital, to a unit. They say that powerlessness generates more powerlessness. When there is power that's bestowed upon people, that can be contagious as well, because you can have an individual who has power and then they empower the people underneath them. So that's a huge benefit. So I don't want you to see power as a negative. It's not. If you have a manager who is powerful and then empowers you to then make decisions, then you see a very positive snowball effect. Organizational authority, power. So you've got the legitimate authority of the position, and then you can have the perceived power, which is different from what they legitimately have control over. And then they have socialization of individuals to power and to authorities. Not everybody responds to power and authorities in the same way. So there are, a lot of that goes into how we were raised, previous experience. And so for some people, it can be very difficult for them to adhere to people in power positions. There is something called the authority power gap. And the right to command does not ensure that employees will follow orders. So can you think of, I don't want to even say it's an ineffective manager because it's not necessarily making them ineffective, but have you ever worked for somebody who would command orders to the staff, but nobody ever did it? Nobody followed through.
Yes.
Can you elaborate on just broadly what happened?
It kind of caused a rift. It was back when I was in college. We had a manager who a lot of people just felt like, how was she even qualified?
Okay.
And so when she suggested something or tried to critique, it was automatically negatively taken and just thrown away. So like upper management eventually had to step in and kind of like just tell the staff like this is what it is, because she wasn't doing it. She wasn't terrible at her job in their eyes, but like to the staff, it was just like, how is she even qualified?
So was it that the staff didn't think she had enough experience, or did they not respect her for some reason?
Yes, both. She didn't have enough experience, and then like kind of goes back to your personal life. It kind of trickled over into the work life, and so she lost all her credibility.
Yep. And that's a huge component of it. So if you don't have credibility with your team and you don't have their respect, you can bark commands and orders all day, but that doesn't mean anybody's going to follow through with it. And so there can be an authority power gap. They have the authority to make the decisions, but the power, it's not followed through with. And there's a lot of different things that can play into that. So it talks about if the manager loses credibility. So Kiyomi hit it right on the head. If they've lost credibility with the employees, people lose credibility, they lose respect, and you're way less likely to adhere to the commands that are being told or the directives that are being told. And now you've really got a unit or an area with chaos because you've got somebody in the authoritative position, but they don't necessarily have power because it's not effective. And it could be for a multitude of reasons. So bridging the authority power gap. Overt displays of authority should not be used unless that is the absolute last case scenario. So think as well, and maybe even in your circumstance, Kiyomi, the person may have abused their authority. They may have gotten to the point where everything was a command and nobody felt that they had the experience to be in that position. Maybe they worked with that individual prior to them getting the position. But now they see that person coming in late, not being a team player. They never help. When you have a problem, you can't find them. So you can't just say, well, I'm in an authority position and you need to do this and you need to do that, because it's not going to be effective, right? The leader should make an effort to know about their teammates. The subordinate is the correct word. I don't love that word. I think when you're a leader, you have a team and you have to get to know them and you have to treat them as an individual. When somebody remembers something about you, for most people, that is huge. So even if you're a leader over 30 people, I had a team of 30, 35. I learned, do they have kids? Do they, of course, after the interview, because you can't ask all that, but, things would get told to me, or they had something important coming up. Get to know them. And when you ask about it, they're like, wow, I think they care about me as a person and not just that I'm a nurse that they're staffing. Manager needs enough information about the organization and the unit to then provide that information to the team so that they understand what is happening. And most of the time, people in a management position have goals to meet. There are certain things that the whole unit has to meet, goals that are set. And people always understand and are more willing to follow through if they understand the why. So instead of giving orders with why are we doing this now? Why is she telling us to do this? It's just more work for us. If you provide that other piece, it's like, oh, that makes sense. I've told you guys, I'm very much that way. I don't mind having to do something that's extra work or something I see as burdensome if you tell me why we're doing it. And if it's for a good reason or if it's for a goal, I get it. And you get the buy-in a little bit better. Empowering your team is allowing them to develop as a nurse. So even though you may have an individual and you're going to be a new nurse, you still want a certain extent of empowerment so that you can grow. You want to grow, you want to develop. You, as a manager, you never want to hold your team back. And that's what becomes difficult. And you all will face this as well. Like, you're going to be a staff nurse somewhere, and eventually you may want to switch units, or you may get offered a position somewhere as a leader, but you are afraid to tell your manager because you think that they're not going to want you to leave. Well, of course they don't want you to leave. You're a good worker. They can count on you. You have a great relationship with them, but a good manager, a good leader, wants their team to develop and advance. And we do that by empowering. Think about even just delegating. When you're delegating to a UAP, you don't want to tell them, I need you to help Mr. Smith eat, and I want you to do this first, and then this, and then this. You've taken away every ounce of decision making from that person. Then they feel like they're a robot going through the motion. We want to empower them because they're going to grow as an assistant personnel. They're going to expand their knowledge. They're going to expand their tasks. And ultimately, that person may end up wanting to go back to nursing school because they've learned more. You gave them, you trusted in them to do for themselves and to help with that. And this is really the hallmark of transformational leadership. Empowerment occurs when leaders communicate their vision. So that should be something that's communicated to the team. What do we see this unit doing? Where do we see us in 6 months? Employees have to be able to use their talents. And so, highlight people for what they're really good at. If you're awesome at urinary catheters, then we want to make sure we don't want to abuse that where they have to put in every urinary catheter, but you want them to maybe they want to become a mentor for new nurses who aren't comfortable. Give them that power to then, now they can teach others. And then learning, creativity, exploration, all of that has to be encouraged. We want people to learn new tasks. You don't want to keep them in this bubble where all they know how to do is this one thing. That's where cross-training comes in. A lot of you will be cross-trained, sometimes to multiple units. Sometimes you'll be cross-trained within your unit. I know, like in surgery, you got cross-trained between pre-op, post-op, or PACU, pain management, because we want you to learn, we want you to grow. We don't want you to only be able to perform one task, and it increases your possibilities in the future. What if you leave? Now you can do 5 different things, and a good leader will want that for their team. 6 driving forces to increase nursing power base. Timing is right, the size of the nursing profession, referent power, which you're going to go over, the perspective of nursing, all of that good stuff. So I think the majority of what I wanted to talk to you about was that information. And then you can read through the rest of this. All right, so what we're gonna do is it's almost 3:10. We'll take a 10-minute break, come back at 3:20, and I want to go through just a couple things in chapter 14, and then I want to do another case study on the leadership ATI. So I'll see you back in like 12 minutes or so.